All right. Hi, everybody. Thank you for coming. Welcome to Feminism in Theory and Practice, which is an online talk series hosted by the Michelle R. Clayman Institute for Gender Research here at Stanford. And it's an opportunity for us to bring together people who are really innovative as writers, as scholars, as activists, and whose work is touching upon gender inequality and how to fight it. And I think today we have one of our most urgent and vital and surprising speakers that we've had in this series, Makayla Montoya Frazier, the founder of Texas's Buckle Bunnies Fund. I'm really thrilled that Makayla is joining us. I've been an admirer of hers for a really long time. I'm going to read her bio so you guys can get appreciation for just how cool she is. It says here, through her lived experience as a sex worker and Texan who has had abortions, Frazier has dedicated her 20s to fighting for reproductive justice through mutual aid and harm reduction practices. Buckle Bunnies Fund, this is the abortion fund that Makayla founded, is an abortion mutual aid network that operates across Texas, providing abortion funding, practical support, and harm reduction materials to tens of thousands of Texans every year. Due to restrictions on abortion in Texas, this has become more expensive, urgent, and dangerous. I think we're in a moment right now where it's very easy to hear people talking about the law, and it's very easy to get a lot of access to takes on the politics of abortion. And what I wish we had a little more of in the national stage, and for those of us here in Democratic controlled states like California, is a picture of what it's really like to try and access abortion care in one of these banned states, what it's really like for the people affected. And I think that there's nobody who is confronting that issue with as much generosity and tenacity and grace as Makayla. So I'm just really so honored that she joined us here today. And Makayla, thank you. I'm going to hand things over to you.
That was so nice. Like I almost cried. You really got me, Moira. You really did. I'm so thankful, glad to be here. Buckle Bunnies is like not traditionally invited to do things in higher education and whatnot, due to our reputation as baddies. So I'm very appreciative. Yeah, so we're Buckle Bunnies Fund. We fund futures deep in the heart of Texas. My name is Makayla Montoya Frazier. I'm the founder and co-executive director, and my pronouns are she, aya. If you want to go to the next slide. So I'm a 25-year-old Leo son, very important, living and working in San Antonio, Texas. And I come from 7 generations of working class San Antonioans. I began my journey as a community sexual and reproductive health specialist through my lived experience as a young person in the sex trade who has had abortions in Texas. And outside of organizing, because we are people at the end of the day, I watch a lot of Drag Race and rehabilitate stray and feral animals. Yeah, that's me. Go to the next slide. So a little bit of our Buckle Bunnies timeline. We were born in 2020 after Greg Abbott decided, abortions are elective procedures and people don't need elective procedures right now because COVID's going on. Although we knew that Greg Abbott didn't really care about COVID, he didn't have the urgency that was necessary for a pandemic of that scale. So we came together and we decided to share information about abortion pill resources and fundraise for people receiving out-of-state abortions. And in 2021, many of you know that SB 8 happened. I will touch much more on that law later. So that banned abortion after 6 weeks. So at that point, we were only around for a little over a year. And then about a year after that, Dobbs happened. So that was owie. It really like double got us. But so our fund at that time was then the only fund left in Texas for about 10 months. Today, most funds have resumed funding out-of-state abortions and travel, but patient demand is outpacing um, the resources that funds have at the moment. Next slide. So why buckle bunnies? Why us? That was something that we heard a lot of when we first started. In 2019, during my first abortion, I was 19 years old. I didn't see myself reflected in the care or support that I received. San Antonioans and rural Texans only had access to maybe one abortion fund with 4 hotline hours a week. Organizations and clinics didn't talk about self-managed abortion due to legal fears or the misinformed idea that in-clinic care was superior. So that was something that really, I think, touched a lot of us in our personal lives. Many of the people in Buckle Bunnies has had abortions, in clinic and self-managed abortions. And I know that if I would have known about self-managed abortions when I was 19 accessing an in-clinic abortion, I probably would have had a self-managed abortion. But that wasn't an option at the time due to the stigma and the fear. So from our creation, our primary goal was to inform people of their self-managed abortion options and provide peer support through the process. We also aim to fill gaps in procedure funding and patient navigation. Our reproductive justice values led us to embracing a mutual aid structure over a nonprofit status. So we've always embraced companionship over this kind of like robotic system and processes that some clinics and some funds, have to model after due to patient demand or restrictions in their nonprofit status and whatnot. So next slide. So the landscape of abortion in Texas, pre-SB and Dobbs. So after 2000, Texas faced a number of abortion restrictions that made abortion extremely difficult for people to access. It wasn't just SB8 and it wasn't just Dobbs. Abortion was banned after 24 weeks from 2000 to 2013. In 2005, parental consent became law, not just notification. And then 2011, that's when the 24-hour sonogram and ultrasounds became mandatory before their abortion. And then in 2013, abortion was banned after 20 weeks. So we see those restrictions already impacting low income Black and Brown Texans, people along the border who don't have the ability to travel, and specifically young people who don't know that they are pregnant before 20 weeks. Um, and that happens a lot. So we've had patients who, because they're in that 100-mile zone of the border that they can't cross the checkpoints, then they're not able to obtain their abortion. And then they're, having children that they might have not had, were they able to access an abortion. So while that was all very difficult, people were still accessing abortion in Texas. We see, though, that after 2023 and 2023, everybody in Texas almost was having to travel over 200 miles to the nearest abortion provider. Um, so yeah, and that's pretty much still where we're at. Next slide, please. So SB8, boo. Can I get a boo in the chat? So yeah, SB8, Senate Bill 8 bans abortion care after 6 weeks of pregnancy and carries a private enforcement provision that empowers anyone to sue a provider or someone who aids or abets the procedure. But shortly accompanying SB8 was SB4, which prevented physicians or providers from giving abortion pills to patients who are more than 7 weeks pregnant or from mailing them within Texas to another Texan. So these laws, people think that because we exist right now in a total abortion ban, that these laws don't, they're not still, active. But they are. If Roe were reinstated tomorrow, we would still have SB and we would still have SB4. People can still sue people under SB8 and they still are. And there is no limit to who can sue. It doesn't have to be somebody in Texas. They don't have to know you, know what you're doing. The aid and abetting part is not something that has been tried or even true like in court yet. But the provider like suing another physician, that has been tried once in court but was thrown out. So these laws are still very much active, but we don't see them happening in court as much as what we thought would happen. So yeah, next slide. So the impact of SB8 and on our fund and our patients. So we'll start with the good because that's very nice, right? Which is at the bottom. So people were still able to have abortions before 6 weeks, and clinics were offering cost reduced or free services. Fundraising and public support hit an all-time high, so we were able to say yes and to every single caller. We were getting so much money. We did not know what to do with this money. We were like, oh my God, we've never seen so much in our Cash Apps and our Venmos. We've never been able to support patients with such like tenacity before. And so that was very exciting because if people, they're already having to travel somewhere else and then they ask about birth control, we can say like, hey, if we send extra funds to the clinic, you can get an IUD, you can get whatever you would like. And that's not something we were able to do before. We were also able to fund patients with larger cost. We've seen abortions go up to, 15 to $20,000. So being able to fill larger gaps definitely like impacted so many people in Texas, especially young people. So the bad was that physicians did not want to practice in Texas and clinics did begin closing. So increased patient travel led to funding more patient flight and lodging. And then we received our first cease and desist. And that was because Briscoe Kane, which is the state representative here, really, really took SB8 seriously. He's an anti and said that we were breaking the law by giving out information about abortion pills and by funding abortions where somebody could take part of the abortion pill in New Mexico and then take the other part in Texas. So that's something that we're still struggling with. So the ugly part was that Texans struggled to get funding from the larger National Abortion Federation due to legal fears, leaving smaller funds to fill the financial and legal gaps. So we're still fighting an SB8 related case in court. Currently, aside from the cease and desist, which was really disappointing that larger organizations didn't want to go out on that limb to fund the most vulnerable people right now. Um, so yeah, we still are fighting like financially and legally due to all of that. So next slide. So our request for support, you can see how they got a little got a little wild. So post SBA, we provided significantly more companionship to Texans who chose self-managed abortion. Many individuals traveling out of state were 15 plus weeks and needing logistical support. So we noticed that a lot of people, when presented with the option of self-managed abortion, um, they will take it. They know that traveling out of state is not any it's not like the decent thing that's being asked of them by their country, by their state. Like there's no dignity in having to go somewhere else to access healthcare. So when we were able to say, hey, if this is something that you want to do and we will support you, most of them will say yes, because they just need somebody to let them know that that's possible. And then as Plan B became more widely donated, we became permanent emergency contraception and pregnancy test providers, keeping folks informed about preventative measures. I think that's one of the most impactful programs that we've been able to provide for people is pregnancy testing, regular pregnancy testing, and Plan B. People were able to take control of their sexual and reproductive health in a way that they hadn't before due to financial barriers. And then due to the misinformation about, certain pregnancy tests are better than others, like they shouldn't use the Dollar Tree ones, although those are a dollar. They need to use the $12 big ones and stuff like that. So just like misinformation leading to inaccessibility. So with pregnancy testing, folks were able to find out they were pregnant earlier and receive in-clinic care if they chose. So people were able to find out if they were pregnant before 6 weeks and still access abortion care before 6 weeks after SB8. We noticed a lot of people, because of the fear of being pregnant, having to travel out of state, they were taking pregnancy tests pretty regularly. So they would catch it a lot earlier than historically so many people have. So, they'd be like, I'm 3 weeks pregnant, I'm 4 weeks pregnant, 5 weeks pregnant. And they were able to get the care they needed within the state if they wanted to go to a clinic. Um, yeah, so next slide. Dobbs, even bigger thumbs down. Okay, next slide. So after Dobbs, immediately, we all remember where we were. I was at my oven, my kitchen, cooking eggs, making a little taco, and then Dobbs came down. And there was a lot of panic from clinics, from patients, from funds. But there was a temporary restraining order pretty much immediately, so patients were still able to squeeze in appointments at maybe one or two clinics due to the temporary restraining order, keeping the total ban from going into effect. So we provided funds to clinics still operating during that time, a decision that led both to us and the clinics being subjected to a lawsuit that we are still currently in. So within that temporary restraining order, there were a couple days where a clinic here in San Antonio and a clinic in Austin were providing care for free to any patient who needed to come. Um, I think one clinic was for free and then one clinic was like half cost. So we provided like a large sum of money and we were just like literally do all the abortions that you can with this money and go to town. And so Ken Paxton tried to tell us that the total ban was in effect and that with that money, we were basically breaking the law. So that is something we're still working on. So immediately after Dobbs, though, many Texas abortion funds closed due to fear of legal attacks or jeopardizing their nonprofit status. While we empathized with their professional dilemmas, um, other funds, oh yeah, where we empathize with the professional dilemma other funds were facing, our commitment to supporting Texans by any means necessary led us to continue our operations. And I feel very lucky to be at the fund that I am in because that wasn't even a conversation. Um, we weren't ever feeling like we needed to close, like we were at risk if we did not close. We knew that people were going to need us now more than ever. And it's not about our fear and the fear that we're feeling when there's vulnerable pregnant people out here feeling an immense amount of fear. So yeah, we stayed wide open for a long time. Next slide. So how do we adapt? We didn't. So with our focus already on self-managed abortion and accompaniment modeled after Mexican and Latin American abortion activists, we understood abortion as a criminalized act, ban or no ban. Um, yeah, with our partnership with organizations in Mexico and with Latin America, we have always understood abortion to be criminalized, to be legislated, um, no matter what the laws are. People are being picked apart and policed for their pregnancy outcomes at every turn. So there wasn't much changing that we had to do because we were already, so focused on self-managed abortion and the loopholes of the law. So our numbers have remained mostly consistent since SB8, though the 8% who had abortions within the state have been equally split between SMA and out-of-state care. So with that little sliver of people who were before 6 weeks and getting abortions within the state during SB8 were no longer able to do that at the clinics. They were able to either access, self-managed abortion or out-of-state care. I will say that we have seen an increase in medical cases, people who have to get abortions at hospitals. That wasn't happening immediately after Dobbs because doctors didn't know if they were able to provide abortions at hospitals. We knew of one hospital who was doing it, but it wasn't very often, and the requirements for it were quite strict. But now, luckily, some hospitals have resumed that care, so we can rely on them. Very few to take care of those cases. Next slide. So this is where I get into my favorite topic, self-managed abortion. So though the Texas abortion ban seems absolute, abortion pills by mail coming from another state or country and self-managing your own abortion are both legal in Texas. And then sharing information about where to get pills, how to use them, and other resources is also legal in Texas. We can talk about whatever we want. This, the First Amendment, we can really take advantage of that to talk about abortion because it is our right to give out this information. And what people do with it is their business. And that's some of the issues in the lawsuit that we have been facing as well. Them trying to, say that abortion is not included in free speech. Information on how to use abortion pills is not included in free speech, but we know that it is, so we keep doing it. Um, and yeah, so many people who get abortion pills from Aid Access, or they use Plan C and pick one of the organizations on there. Oftentimes, pills are mailed from states that have shield laws that will protect the physician sending them to a state with a ban, or they'll send them for another country and there's kind of not much regulation going on. Um, so yeah, there's a multitude of ways that people are accessing abortion pills by mail, and there's a multitude of community networks who are able to support people locally. So self-managed abortion rhetoric can also be quite rigid, with the over medicalization leading folks to believe a multitude of myths that we often spend so much time correcting. For example, some of our truths: abortion pills are safe and effective past 12 weeks of pregnancy. That is something that we have worked really hard to make sure that people know. And not only that, make sure that they believe it in their heart of hearts. Because when you're in, past 12 weeks of pregnancy, you might feel the sense of urgency to get to a clinic because the cost is rising, because the pregnancy is developing. So letting people know, like, hey, if you still want to do this within the state, um, that is your right, and we support you. So abortion pills can be taken at the same time. So we've also done research and like been involved in other research about simultaneous abortion pill administration, um, with what was it? Getting the 24 to 48-hour waiting period just meet, because between the two medications, sometimes people have lives that they need to get back to. We have a lot of people who we help that are parents, and they don't have 2, 3 days to complete an abortion. They have the day that they took off work. They have the night when their kids are sleeping. So being able to adjust to people's schedules and what they're comfortable with is part of giving that dignity back that Texas has kind of stripped away. And so we also let them know that bleeding can range from light to heavy for as little as a few hours to as long as 8 weeks. There is no normal. When we read a lot of abortion literature, we see these very rigid set of instructions, what to expect, and this is what could go wrong. When in reality, that's the human body is so different than any of us can understand. So we let people know there is no normal for you. There is a spectrum of what is normal, and anything could fall on that. So we act as doulas a lot of the time, answering these questions and giving this information. Next slide, please. Yes. So when was it? I think it was this past June. I wrote a zine called Abortions at My Place. And so it's a self-managed abortion booklet with expanded information, resources, and protocols. So this kind of gives people I think, more of a sense of autonomy to pick which abortion method is right for them. So if they want to stick with the traditional method, they can. If they're over 11 weeks, they have options. If they're experiencing a lot of nausea, they can take it vaginally. If they don't have time to wait those 24 to 48 hours, they do it all at the same time. And if they can't access mifepristone, like so many people can't, then they have an option for misoprostol only. So we see people's abortion journeys and their experiences change based off of their individual needs. And those can also change at any time as well. We understand abortion to be much less rigid and very fluid, and kind of develops with us and our needs and what we're able to provide. Um, Next slide. So companions. So we also let everybody know, like, to take a personal risk assessment before committing to specific roles. We recognize not everyone is in a place to push the boundaries of abortion bans due to white supremacy and socioeconomic risks. While none of the anti-abortion lawsuits have resulted in civil or criminal penalties, lawsuits take time and a strong support system. So that's something we all like very much understand now, that while these lawsuits aren't we're not having to physically go to court. We're not having to pay for our lawyers either because of the graciousness of repro lawyers donating their time. It's hefty on our hearts and our souls and our brains. It's not something really anybody should have to go through, but consistently people are. So if someone is not in the place where they think that they can take that on, there are so many other roles that somebody can take on to support um, abortion seekers. And yeah, we love anybody who gets involved, but you need to know when to say when so you don't overcommit to something. You don't feel like burnt out because you're not in the place to, support someone the way that you wish you could. So we empower, empower, empower. Fear has no place here. It is not personal. Our fear cannot come before the fear of vulnerable patients in need. So we must remain confident in our knowledge of medicine and the law. We empower people by sharing the correct information and centering their emotions while being the friend that they need. A lot of the time, people people get freaked out when they see like these big lawsuits, when they hear, anti-abortion people are doing trafficking ordinances and just very, very specific things. But at the end of the day, people need the information that we have, whether or not we are scared. And it is our community responsibility to share the information that we have. So we push our feelings and our fears aside to make sure people have that information. Next slide, please. So how to support Texans right now. So share information about abortion pills or attend a SAS training. SAS is self-managed abortion, safe and supported. Um, and you can learn how to use and how to talk about abortion pills because I know that people are sometimes a little freaked out about the legality of sharing this information. So they'll tell you how to talk about it in a way that could not incriminate you or anything of the sort. So you can donate to Texas abortion funds or buy from their wish list for material support. We are in my office right now where you can see I have many things. And these things are, some are donated, but some are bought by people who are supporting our wish list. And all of these will go into the hands of people who need harm reduction services, abortion services. And we have a diaper registry too for people to support um, people who have children, who are going to have children and whatnot. You can also organize a fundraiser or tabling event to highlight the work of Texas Abortion Funds. We regularly send some of our goodies, like our pamphlets, some Plan B, whatever, to people who are like, I want a table at my college. I want a table at this bar I like. And we just say like, give it out or associate with us or don't associate with us. Like as long as you're giving out like Plan B or something like that, that's going to impact people's reproductive and sexual health lives, and probably help abortion funds. So yeah, we appreciate anybody who like spreads the word. So my assignment to y'all is to talk to one person about this is two, one person about abortion this week. It doesn't have to be about just like the act of abortion. It can be about abortion funds, abortion pills, anything that you think you could wiggle into a conversation, do it. We we need that information to be spread. Uh, Next slide. So this is the end of my presentation. But our little resource page, if anybody wants to take a photo of it, if anybody wants to follow us right now, because you extremely should, we're so cool. Here's the Buckle Bunnies Fund information with our website, our Instagram, and our Twitter, and then abortion pill resources, aid access, abortion on our own terms, and you always have options.com. So you always have options, actually. Y'all are the first ones to know this. Um, we're dropping a billboard in December, a couple, with Shout Your Abortion in San Antonio, and it will link people to youalwayshaveoptions.com, which will give them information about accessing abortion pills. So that'll be extremely great. Yeah, thank you all for listening to my presentation. I hope you liked it.
Makayla, thank you so much. We have a whole bunch of lovely attendees. I'm going to invite all of them to put their questions for you in our Q&A, and then we can, pose those to Makayla. So anything you want to know about buckle bunnies, about the work of abortion funds, about what it's like to get an abortion in Texas, put that right in the Q&A. And Makayla, I wanted to talk to you a little bit just about like the huge scope of your work, right? I'm listening to you and I'm hearing you becoming kind of like a public health resource, like a legal expert, a sort of international solidarity advocate, a youth advocate, somebody who's had to develop a whole bunch of different emotional reserves of intelligence and capacity. So like how do you get your mind around just the scope of what you have to do? I think abortion gets sort of thought of as this niche issue. And listening to you, I'm thinking about like how many different fields it's really touching on.
I mean, I feel so lucky to like be able to wear all these little hats and be like equipped with this information. I feel like I've soaked it up like a sponge. But it has been, really difficult to just have all of this information and then kind of like replicate it in your own community because what good is it if you don't share it? And sometimes it's like mentally extremely taxing. But then we always have to just like recenter yourself and be like, it's not about me. Like it's about the work that I'm doing. Like my me time is about me, but my work time, if people need me to be their therapist, be their mom, hold their hand, go to court with them, something like that. That's what is demanded at the time. And so I've just felt really lucky to for people to have that trust in our organization. I think that's what motivates us to keep learning and keep moving.
So you mentioned a few times your companionship model. I've heard about this model emerging from like Mexican reproductive justice organizations. Do you want to talk a little bit more about what companionship means and how it might differ from other kinds of models of like reproductive healthcare and access advocacy?
Yeah, I would say it's most closely related to the abortion doula model that some of the other organizations are already doing and have done for a while, very beautifully, might I add. So just being that friend, that person in front of another person, and just like recognizing like we're both humans here and we're gonna get through this next part of it together. And I am able to support you medically with any questions that you might have. And if I am not, then I am well connected enough to have somebody else able to help you. It's a lot of like being prepared for everything possible while keeping like your composure very together because it's once again, about somebody else getting from one point of their life to the next.
What is your relationship like with other funds? Particularly, you mentioned funds or organizations in Mexico and Latin America. How has your work become international? You are so close to the border there. What does that look like for you?
Yeah, so I would say at the beginning of our career, our time, our birth, we faced a lot of like issues with some other organizations, maybe like some territorial vibes. I don't know what was going on, but it was people thinking that there was enough funds in Texas. There was 10. That's so many. Like that sounds like so many, right? But realistically, like Texas is so big and the gaps were so huge. So I think people just taking a step back and being like, we cannot do it all. We need to let other people in. And that's kind of we kind of built up from there. I think just like solidifying our relationships with patients, solidified our relationships with other funds. And then Mexican and Latin American funds reached out to all of the funds in Texas and said like, hey, we have this knowledge and this like ancestral practice that we can tell you about and we can provide that information very graciously and kindly. And we were like, that's exactly what we need. Like we recognize abortion as this communal thing and as this very public good. And they felt the same way that we did about abortion. They felt that it had been like non-profitized enough, that we needed to bring back this sort of like grassroots model. And I think that's what Buckle Bunnies has always been, is we were born out of mutual aid, and we've stayed that way ever since.
Am I right that you guys are not technically a 501(c)(3)? You have a totally different like finance classification?
True. So actually today things will change. With our fiscal sponsorship, that is soon to change, but I don't know what.
Wait, wait, wait. Tell us about your fiscal sponsorship and then we can talk about the mutual aid model. Because this is
Yeah.
very exciting news for Buckle Bunnies.
Yes. So for the past 4.5 years, we've just been individuals calling ourselves Buckle Bunnies. Like, it hasn't been an incorporated organization. We're just a gaggle of bitches bitching. And we've kind of been okay with that because it does make lawyers and lawsuits have to go at us as individuals and not as an organization. So they're not going to go after, six, seven, eight, nine of us, however many there is in the organization at the time. They're gonna pick one of us. And even if one of us is like tied up with law stuff, the work can keep going because the other eight of everyone is good. So for a long time, that has been our model. We recently, today, this morning, signed our fiscal sponsorship agreement with IPAS, and they do international abortion work. And they're super amazing. And they super understand like our commitment to international abortion solidarity. So the values like are aligned very perfectly. So after today, we will be tax exempt through them somehow.
That's
Laws.
beautiful. We have a question from one of our attendees. Somebody was brave enough. Oh my God, two people were brave. Okay. Our first question is, how do you stay on top of the medical literature? What other checks do you have to ensure that you aren't accidentally practicing disinformation?
Um, yeah, so we not only are we like on top of it because we read so much like literature from other OBGYNs that we know, and especially in Texas. We also have extensive like lived experiences of abortions, of like reproductive health complications. So we've all like individually spent time researching our own bodies and talking to doctors about this. But yeah, we've been pretty tight with a lot of like abortion medical providers, doctors, and whatnot. Even people in Buckle Bunnies are, researchers and, studying to become doctors. So, yeah, we're always in there.
Yeah, we had a wonderful panel through Clayman, I think 2 years ago, a panel of abortion providers. And one of the things that this young provider named Brianna Peacock, who is in Georgia, I remember her name because it was so great. She told me that a big part of becoming an expert as a doctor, as an OBGYN, was just the repetition of the work, just doing 100,000 DNCs
Yep.
is how she learned to determine when it's going well and when it's going badly. And I
Yeah.
think that's the kind of principle that can also apply to people outside of a formal accreditation system, right? Like it seems like in addition to being somebody who's very well read and very up to the minute in terms of developments in reproductive health care, you're also somebody who's done this a million times. And so are the people working with you in this group. I'm gonna move
Exactly.
on to one
We've
more
all
question.
Oh, sorry. I was gonna say we've also like relied on like Mexican and Latin American abortion funds who have like done this work also for so long and know the medical ins and outs because of the repetition. They've shared so much information with us as well, and we are so thankful because now we're like supported 15 to 20,000 folks with their self-managed abortions. So the repetition has definitely like solidified us.
You get to draw on that big well of knowledge too. We've got another question from Jude Garcia. Hi, Jude. Sending love from Oakland, originally from San Antonio. How can people in other states build cross-state solidarity and support with y'all? Financial, personal, anything.
Wow, come back to San Antonio. Yeah, we obviously financial is something that's always going to be needed from organizations like ours. We're spending at least like $500 per person who's reaching out to us for out of state care. So pretty much any financial things that people have, we do a lot of issues-based campaigning, like raising money for specific projects. Like say we have 10 people who need flights and this $4,000 we'll book that. So if you see us doing like issues-based projects like that, those are great things to push and we really support and appreciate it. On our website soon, we're going to put like our pamphlets and printable things. And if you would like to print them out and put them in your city, places where you hang out, that's always a good way to help people know us and help us.
We've got a question from Stella Rower, my student. Hi, Stella. Thank you for coming. Stella asks, does Buckle Bunnies work with similar grassroots organizations in other states with restrictive abortion bans? Is there a supportive network of organizations across state lines?
Yes. Yeah, all the abortion funds and abortion mutual aid networks are, tied into larger networks. And there's some that are not maybe not the abortion funds themselves, but kind of the individuals in the abortion funds who want to do the mutual aid work or want to do the SMA work that they might not be able to do at their fund. So there is a lot of like cross fund solidarity, especially between banned states, because we are all sharing the same $20 and asking each other typically about the same patients.
Got another question here from Allison Crosley of the Clayman Center. Hi, Allison. Allison says, thank you so much. I feel honored to be in your presence. Do you see yourself as part of a larger arc of reproductive justice organizing in the US over time? In addition to the Latin American abortion funds, who or what orgs have inspired you?
That's a question. Wow. I'm also so honored to be in your presence, Allison. Um, yeah, who or what orgs have inspired you? I mean, I'll start with that. Like Los Libres, is one, and Necesito Abortar are the ones that we have like the closest relationships with, who have done a lot of training and a lot of peer support with us. Like, not even as just like abortion providers and community support networks, like as people and as friendships, like we have, really deep ties with these people. And then yeah, a larger arc of reproductive justice organizing. I hope so. I do believe in San Antonio and in Texas, we have shifted the narrative of self-managed abortion, and we have given so many people the gift of the information of self-managed abortion. That's for some people giving them their futures and the rest of their lives. So I hope that not only like we have made that impact, but these people can go on to make that impact if they would like to as well.
And we have one more. I think you just answered the question from anonymous attendee. What are some of those orgs in Mexico that y'all work with? Yeah, Los Libres is everybody should be researching Los Libres because their model is amazing. And I think it's being reproduced a lot in the US, especially my students. You guys should Google them. And then we have one more question so far from anonymous attendee who asks, what do you wish Texas media outlets were covering with buckle bunnies and abortion access as we are down to the wire with elections coming up?
Ooh, I'll start with the what I wish they would not cover actually, because I feel like that's kind of like an easier segue. Um, yeah, I mean, y'all see it, you all see it with the media covering abortion in Texas. A lot of it's the trauma stories and the sad stories and the people who are 8 months pregnant with a fetal anomaly and they really wanted the baby, like stories like that that are more digestible. They're more respectable a lot of the time. And I'm not saying we should stop covering that because those people deserve all the attention that they're getting, but typically abortion isn't like that. And abortion in Texas isn't always like that. While people do have to travel and all of those things, I think we need to focus on sort of the positive impacts that abortion has in people's lives, not just the moment of struggle and vulnerability. It's like what comes after and what can you do now that you've had the abortion. And I think that's also like diving into people's complex feelings about abortion. And I think that that's always great to touch on, like destigmatizing of like the emotional complexity of abortion. Not everybody's happy and not everybody's sad. Like there's this very in between, and I think it's okay for all of us to talk about it. I think the mess is what needs to be covered a little bit more.
Yeah, something since Dobbs, I've noticed that media attention on the impact of abortion bans has focused a lot on married, middle class, often white people who have health complications for wanted pregnancies. And there's absolutely nothing about those people that offends me or that I think makes them unworthy of our sympathy. I think they're in awful situations. But I do wish we saw a little bit more of the full picture of abortion, which is so much bigger than this narrow focus can take us. I'm going to take you to a question by another one of my students, Audrey. Hey, Audrey, who asks, where do you see the future of American abortion laws going? Do you think they will become more restrictive, or do you think we'll have another push towards legalizing abortion and allowing women autonomy of their bodies?
So I am not a great legal mind by any means. I am a great mind. Great pair of legs too, I think. But I feel like the way that abortion is going in Texas, like we do have a really hard uphill battle for the next 5 to 10 years. Um, it's not like they can restrict abortion more than it's been restricted in Texas. I mean, they can, unfortunately, in like little ways with the Comstock Act and the abortion pills by mail. I think getting more restrictive against people who are pregnant and who are having abortions. I know last ledge season, they tried to remove protections for pregnant people who are having abortions. They weren't successful, but I see that happening again. Um, so I think we're in a really difficult place in Texas, and that's why organizations and community networks that are doing the work are so important right now. I don't, I think that I'm not gonna say like I don't think the election's gonna change anything, but I do think that these local issues that we have, like the props and the amendments and whatnot, are so worthwhile in our communities to vote for. So I hope that people, if you're in a place where there are abortion amendments on the ballot, I hope you tear it up. I hope you get in there and you go crazy.
And we've got one more question from Zachary. Hi, Zachary. I imagine your work requires an immense amount of emotional strength. I'm wondering how you prepare yourself and protect your mental well-being to engage with this issue.
Wow, Zachary, that was so you're so right. Yeah, I will say there was a lot of the time because I am young. I just turned 25 this year and I for a lot of the time struggled with how far was like far enough to push myself and to push my boundaries and what I was capable of doing. And that led to like an immense mental breakdown to where I couldn't be the leader that I wanted to be and I couldn't be someone who is a resource to my community the way that I wanted to be. So I think taking a step back and being like, hey, you gotta focus on you a little bit because if you're not there, then you can't help anybody else. And it's not even that like I view myself as like this service or anything of the sort, but I just, my passion is to, provide for people in the way that I wish that I was provided for. So yeah, I think there's been a lot of like ups and downs, but also like recognizing when to say when now at this age has definitely helped a lot. I need to hit pause on so many things in my life and recognize that that's totally fine. Like we are all human beings.
On that note, I wanted to ask you about the experience of getting sued, because you are the target of a lot of legal antagonism. You're in this kind of like David and Goliath situation where I believe is the state of Texas suing you personally? Is that what's going on?
No, so weak. They couldn't even if they wanted. Um, no, like nobody who works for the state is allowed to like target someone directly for these abortion lawsuits. Like they cannot work for the state or have anything to do with the state whatsoever. But they can weaponize their friends and their relationships with other people to to others like me. And so that's pretty much what happened is this random married couple just their names are Zach and Ashley. Find them. They just were like, we're gonna sue you for a potential SB8 claim. And you did it. Like we're gonna say that you did it. So I've been in that case for over 2 years. And yeah, it at first it was like really jarring because it's a 55-page document accusing me of murder. And at I think I was 23 when I read it, and I had smoked before too. I was looking at my screen, I was like, "What are they saying about me?" And it made me a little, like, crazy, like, it made me feel so unsafe in my
Mm.
position, but then realizing, like, "Hey, these people are all bark." Like they're trying and trying and trying and trying because they're failing and failing and failing. So being able to like connect with wonderful lawyers to represent us and support all the abortion funds in Texas, like nothing's happened. I do actually have to give a deposition. Bleh. Um, but that'll be nothing. Like I'm so confident now with the support that I've had.
I think they're afraid of you, and they should be because you're really changing the game there. Makayla, I want to thank you so much for giving us your time and taking time out of doing this incredible work to share it with us. I've learned so much from you. I've got so much admiration from you, and I think you really showed us a new model of how to advocate for abortion access. And I'm just so grateful. Thank you.
Y'all are so
Oh
kind.
wait, we have more Q&As. I'm sorry. um One Mandy De La Rosa, hi Mandy, asked, Buckle Bunnies is such a staple in our community. What motivated you to start the funding? And did you predict you would be where you are today?
Mandy is one of our emergency contraception community providers. So that's one of our amazing projects is we give people like boxes and boxes of emergency contraception to provide in their own circles so that people aren't just coming to us all the time. But yeah, I mean, I guess just like not what was that? Yeah, not being able to have the abortion that I wanted to because I wasn't able to access all the funding. I had to delay my abortion about a month. And so I was almost 16 weeks when I was pregnant, and it was much more expensive and a much more physically consuming procedure than I had wanted. So knowing that if I could change it, I would, and then realizing that I was in the place that I had the power to change it for other people.
Oh, yeah, you do. And Leslie asks, this is a great question. What's the best way for a journalist to get in touch with Makayla?
Ooh, Leslie. Um, Leslie, if you would, Moira, if you could share my email with Leslie or however,
We can do that.
that's perfect for me then.
Makayla, thank you. I think I learned a lot. I'm really inspired, and you've given me like a lot of hope and energy for the rest of the day. And thank you to our guests, everybody who took time out of their day to join us in this webinar and learn. I think you really inspired a lot of us today. So thank you, Makayla.
Thank you so much for having me. I really appreciated everything. And yeah, I will send this thing to you and you can share it with everybody.
Bye.
Bye.